space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Vinaya-Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Vinaya-Rednam.
Welcome back to the Confidence Doc podcast. I'm Dr. Rednam, and I am a board-certified plastic surgeon in Houston, Texas. I have an exciting guest today because this is a behind-the-scenes person that many of you have no idea is even involved with a lot of your surgeries. Today we have Shibu George, and he is a hospital surgical rep. Thanks so much for being with us today.
Thank you for having me.
So Shibu, for those of us who don't know what a hospital surgical rep is, can you explain a little bit about what your job is and who you work for?
Ladies and gentlemen, my name is Shibu George. I am a hospital surgical rep. I work for Allergan's, the Allergan division of AbbVie. AbbVie is a big pharmaceutical company. It's got several different wings and divisions, and I actually work for the hospital surgical division. My job is basically to be a medical device rep. That's a giant umbrella in the medical sales world. You've got pharmaceutical reps, you've got capital sales. We have products that our plastic surgeons need, and we basically support their needs.
So Shibu, how did you even get into this? Like, where was your start? Because it's not something a lot of people are like, when I grow up, I'm going to be a medical sales rep. Like, I just don't think it's something people even really know about.
Exactly. My background is actually very unusual. I've been in the sales world for about 20 years. I actually have a degree in psychology, a minor in marketing. I ended up coming to Houston to go ahead and get my MBA and a master's in healthcare administration. My joke was like, I don't know what I'm going to do, but I'll eventually figure it out. And so I was going down this path of going to becoming one of the executives at the hospitals. And I found myself working in different divisions of healthcare. I was an underwriter at one point. I managed a group of physicians. I worked in the hospital systems. And then at one point I was helping to manage a group of gastroenterologists and liver transplant surgeons at the medical center, and they dissolved their practice. And they took one practice and they wanted to turn it into three. And they said, well, obviously, we're starting up a new practice at Shibu. Thank you for staying on board to helping us set this up. But obviously we can't pay you anymore. And you're getting these wonderful graduate degrees. What are your thoughts? I said, working in the office, I got a chance to bump into these wonderful pharmaceutical sales reps. And I thought, you know what? I think I'd like to try my shot at sales. I've never done sales before. They were super encouraging. They basically said, we think you'd be great at it. We're going to write some letters of recommendation. We're going to go ahead and reach out to some of the people that we know. And then sure enough, I got a chance after interviewing for several months, an opportunity to get on board with Merck Pharmaceuticals. So I was a pharmaceutical sales rep for about 7.5 years. I loved it. It was great. These companies, these multi-billion-dollar companies, they have a lot of resources. And so they can go ahead and pour all this wonderful science, scientific studies, how to dissect a scientific study, how to navigate a hospital system, all these wonderful training tools, and they set you loose. And then it's sales. We basically go ahead and market our product as well as go ahead and check in with the needs of our physicians. In pharmaceutical sales, mainly you're just marketing your product and you're talking about studies and how these can benefit your physicians and the patients. But then I wanted to change gears a little bit and get into medical device sales, which was harder than I thought, but eventually cracked the code. Got on board with a company called KCI. I was a wound vac rep, and sure in your training you've used one of those. Did that for about 5 years or so, then changed gears again, got on board with a company called Zoll LifeVest. So I started calling on cardiologists and electrophysiologists. It's a wearable defibrillator. And then changed gears yet again. And I've been fortunate enough to be Dr. Rednam's rep for Allergan AbbVie for the past 5+ years. So
tell me, why did you decide you wanted to switch from pharmaceuticals to more devices?
So the pharmaceutical industry has gone through a lot of changes. As you can imagine, when I first started off back in 2003, my training class had about 66 people in it. It was huge. The pharmaceutical companies could do no wrong. We had blockbuster products coming out, but then the landscape started changing. It just got very politically expedient, I'll say, for politicians to go ahead and blame the costs of pharmaceuticals on these evil drug companies. And so we were limited really on the type of interactions that we could have with our physicians, which is kind of a good thing. I mean, at the end of the day, it's all about the patients. And, we have these wonderful altruistic ideas on what medicine should be, and that gets very political. But what would happen is there were so many changes happening, and then our products would lose patents. Mm-hmm. And so they would start going through rounds of layoffs. And, how tenuous is that? We'd have to sit at home and kind of figure out, do we have a job or not? And then, sure enough, one of my buddies from training actually became a device rep. And I met him at one of these conferences and started learning about it. You basically are held really accountable for your product, your territory, and what you can do. And I'm one of those type of people. I'm not afraid of hard work. So I thought, let's give it a shot. And plus, it also got me into the OR, which has always fascinated me. If anyone's had an opportunity to go ahead and shadow Dr. Rednum or any of the physicians, it's an amazing experience because you're actually seeing how talented she is, and you go in there and see these patients come out and these wonderful outcomes, and it's life-changing, especially for some of our cancer patients, which is always just an amazing thing. So that's what got me into it. And the truth is, in the world of sales, medical device sales is actually one of the top paying jobs. So it's very lucrative if you're good at it.
It was a smart and passionate decision.
Yeah.
And then you're right. The operating room it's a whole nother world.
Yeah.
And it's hard to explain unless you've actually had the chance to experience it.
Exactly.
And I think I wanted you to go through this. Why I wanted you on here so much is that, unfortunately, when you look at a movie or you see stuff out, the drug rep is always this evil, slimy person. I'm not to say that there haven't been history of certain events and certain specific drugs, especially. Yep. That's not the case now, right? Especially with the medical device reps, you're working with surgeons, right? And for us, you're an integral part of the team because especially when you're new starting out, you might need to learn a lot about more of the devices that are available. Mm-hmm. You're kind of a right-hand people because sometimes we change our minds and then we call you and we're like, we need this instead. Can you find it for us? There's a lot of continuing education that goes on between our reps, and it is a relationship that we build over time. Yeah. And so Shibu was the first person I thought to think of because I was like, oh, he's one of my favorites. And it really is something that you have to build that relationship because there has to be a lot of trust, because when there isn't, then we don't want to call you. Right.
I was joking around with some of the girls earlier about my role in device because service is a huge component of it. And it's one of those type of things that there are so many moving parts that go into the actual date of the surgery, whether it's getting the products there, coordinating with the physician's office, the hospital systems, making sure everybody's got what they need, and then be ready to change. Because how many times have I gotten a text from you and said, hey, we just met up with the patient. Looks like we're going to go this route. Could we go ahead and make sure this stuff is available? And I would just, make a few phone calls. You got it. We're going to make it happen. So I always joke about it. Like if you basically are used to a set schedule, this is probably not your cup of tea because things change real quick. And if you kind of like that excitement, that's great because, it's one of those type of things. Every day is different.
And it's like a lot of things. When the pay is good, it's because you're working hard to get it, right? And I think that as you continue, you kind of started with one product and then you kept evolving and changing. Mm-hmm. And what I found from a lot of the medical device reps that I work with is that's very common. Yeah. That people kind of, find something that interests them more. Sometimes they'll feel like I've reached my peak of here and I want a new challenge. And so then there's actually some reps I've had for multiple things, the same person, but different items every time.
Exactly.
What do you think is one of the most challenging parts of your job?
Challenging parts of our job could be the fact that it's hard to kind of predict what's coming. You have to be ready to change. You have to be ready to go ahead and change gears, kind of prioritize. You want to plan out your day, right? And if you're not a planner and you're just winging it, you're probably not going to go very far. Mm-hmm. And if you've been successful in previous jobs, you can take some of those skills to this line of work. But that's why you said some of your top reps have been around for a while. Mm-hmm. I joke about it, but the salt and pepper actually helps. God tells folks, yeah, this isn't his first rodeo. He's been out there and he's open to change. And it's one of those type of things that you want to take your ego out of it. As if you're going to be successful, I think in anything that you do really, but as a sales rep, if you can take your ego out of it and go ahead and say, what do we do? Because we're part of the team. And that's the way I look at it. Like every time I work with my physicians and my hospitals and my nurses, everybody, we're all part of the same team. So if I don't win, if we don't win, if you take on that type of attitude, that'll help you out, because sometimes the days are long. I was actually up here in the Woodlands earlier, talking to Dr. Rednam, went back to my house, came back up here. I'm going to go back into the Met Center. So it's just go, go, go. So luckily for me, I worked for a company that actually does give me a company car because I'm traveling all over the city. So that does help. And so depending on where you work, right? There's some folks out there that change gears from working for a big company and they become like a 1099 employee. So basically they don't make any money at all until they sell their product. And there's no expense account to take folks out to dinner or educate them. It's all on you. So that could be a little rough for some folks. And so, it just depends on what you're comfortable with. I think we may have discussed one of my friends from the UT program. She was graduating. She got married. Her husband just graduated with a master's degree in case management, like a social worker, but he wanted to go into medical device. And so we started talking to him about, what are some of the opportunities. And he's got a military background, which medical device companies love. If you're an athlete, they love that too, an ex-athlete, because those are skill sets that you develop, that you're trainable, you're coachable.
You're hardworking.
You're hardworking. You don't mind sweating, right? So he got on board with a trauma company and those guys put in the hours because, especially level 1 trauma. So I bumped into the surgeon at one of the big hospitals. She said, how does he get a job like you where he's got like a specific cases, like at a certain time versus, going in and all sorts. So I was like, I've been doing it for about 20 years. So you got to do
your way up.
That's right.
There.
That's right. You got to start off somewhere, cut your teeth, get some skins on the wall. That shows at the next job that you interview for that I'm good at what I do, and that's how you can go ahead and pick and choose your type of company and job that you work at.
Well, I was glad you said that because I was waiting for you to say dealing with all these surgeons. Surgeons typically don't always have the easiest personality to work with. So I guess that's where we're doing okay.
Yeah. Well, the nice thing is I've got such a varied background from calling on cardiologists, electrophysiologists, specialists from all these different fields. And fortunately for me, I really like working with plastic surgeons. By and large, they've got a lot of personality. I know as patients, if you come in here and you immediately gel with a certain doctor, you've got that trust. And it's because they're very personable. They're very personable.
We try. So kind of going back to the days when people, are like, oh, drug reps are bad people, right? Like, obviously that's not the case, but like, there are a lot of people out there who still very much feel that the way that you make sales is by coming in and giving us free trips to Hawaii, giving us all sorts of things. Like, can you explain to our listeners what the reality of that actually is?
Absolutely. I'm glad you brought that up because it's really interesting. When people think of sales, they typically, unfortunately, have a bad idea of sales because they're used to a used car salesman or somebody who's got some catchy phrase and somebody picks up on that. And the reality is there's so many situations where you was seeing bad salespeople in your life, the telemarketer, those type of things. That's not what we do. I think at this level, the really good people that are really good at sales. Here's the funny thing. I take this as a compliment. I've actually gotten some physicians and some of my customers tell me like, Shibu, I like you because you don't really try to sell me anything. And I say, that's what they think.
His work isn't.
In reality, if you're good at what you do, it doesn't come off as being salesy, which that's never been my style. And the reality is I like to take a consultative approach. The reality is there is a situation, a problem that exists that some of our customers may have, say a need. And we talk about the cases that you might have coming up. And I suddenly, in the back of my head, something goes off, oh, there's a product and a protocol that might actually help. And so that's when I get excited. I was like, hey, I just learned this at this one dinner, this lecture, and it goes right in line with our FDA indication. And then the benefit is the patient and our surgeons benefit from it. So that's a fun part of it. Now it's true. It always takes, one bad apple to go ahead and start down that path of a bad reputation for pharmaceutical reps or device reps. And I'll tell you a funny story. Back early in my career, I was in the medical center, and I had a bunch of pens with my product on it.
Mm-hmm.
And it was a box on this little dolly, and a patient came up to me and she picked up my pen that I was going to leave the doctor, and she said, "This is why my doctor put me on this medicine, because you gave me this pen." Which I started laughing. I go, "Ma'am, that's a 3-cent pen from China. It'll probably stop working in the third time you use it. There's probably a good reason why he put you on a medication, because they went to medical school. And I believe me, they're not putting you on this medication or using my products because I gave them a pen. It's just, there's like little things you can give away because of the politics of things. We're limited on what we can supply. I think you may remember back in the day, they might have like boxes of Kleenex or like table paper or whatnot.
I mean, the pens really have disappeared. As a residency, we would get all sorts of pens.
Oh yeah.
And this is like a total side note, but I remember, Viagra coming in and they hit the coolest pen. I'll leave it up to your imagination, but when you hit the button, it flopped. It like went straight. It was pretty neat. It was kind of but it was very effective.
Yeah, and it's funny.
It's funny. It was memorable.
Yep.
But those are the type of things. I mean, they always used to joke, because it's a joke that doctors never have pens on us, because we don't. And so it was always nice to have a pen. But yeah, certainly a pen never made somebody change what their prescribing patterns were.
Right. And in the world of surgical sales, outcomes matter.
Mm-hmm.
If we have a product and it's not working out right, I love hearing the good and the bad from my physicians, because I want to get to the bottom of it. And if I can't answer those questions, we rely on our medical science liaisons to help us tackle that issue or the problem. And we try to educate ourselves as best as possible and stay on the cutting edge of this, just like our surgeons. There's certifications we have to take every year, as well as stay informed on hospital policy. We can't even walk into a hospital without getting credentialed. So if you don't do all the right things and stay up to date on what to do and what not to do, you're probably not going to last very long. That's the reality.
And that's just the thing, is there has been a lot of policies been placed to protect patients, because just like Shibu said, there's always going to be bad apples on both sides of things, right? And so people can be swayed, but in general, I think your doctors are always trying to do what's best for you and trying to look out for you. Sometimes the reason they prescribe you the new medication or they use the new device is because that's what it's new, and maybe it has better indications than the other. I'll give you an example of where Shibu's non-sales actually came into place. Is that I used to use a different implant company quite a bit. And I had a really great relationship with my sales rep, and it was what I trained with, and so I was comfortable with it. And in some ways, I was actually intimidated a little bit about the devices that Shibu used. And so something came up, my rep actually retired, and Shibu was like, "Hey, can I just show you this? Don't be intimidated by these." And the more I learned about it, the more I realized, hey, I think I do want to give these a try. And in no way was it like, salesy and things like that. It was literally like, "Hey, why don't you just try these?" And so I actually spent some time really trying them on, and I realized I really loved this device. And it was just me giving it a chance. So for me, it was an educational purpose, how I got involved. And now I speak for them because I really am happy with what I learned. So that was a case where I think my patients overall are probably happy that I got to learn about this and find something that I really liked, and I think has made my results even better.
Awesome.
So I think it's a really good example of where this was not I didn't get any big incentive other than getting better outcomes for my patients. And that's what any of us wants to achieve. So
that's great.
Yeah. So I will always remember you.
Oh.
But all along the way, I learned that we have to try new things as surgeons. Otherwise, we can't improve our results.
Right.
So, I mean, there can be things as small as me trying a new wound dressing or me trying a new, prep for something.
Yeah.
And so we have to continually educate ourselves and get better. And specifically where representatives come in for us is that they can help us get that education because our time is short. We always should do our own education too and learn about things because everyone should always get as much information as possible. But it's a really nice resource for a starting point to introduce you because sometimes you don't even know that something new exists.
Right. I even tell some of our young plastic surgeons that are going through residency, sometimes it's like drinking out of a fire hydrant. There's so much coming at you. And then when you're working, when you think you're done with school, you're never really done because there's so much education, so many new products out there. So if we can earn the trust of our physicians, to give them good quality science, good quality data on the products out there, the upcoming competitors as well. And then of course, it's important to go ahead and find out, is this good or bad in your hands? Mm-hmm. And then that's where the confidence comes in, because, we've got such a great relationship. And luckily for me, I work for a fun company that's got products that have been around forever. And we put a lot of money into research and development to, if there's an issue that moving forward, the next variation will address that issue. Mm-hmm. And that's a lot of fun. And so then we partner with folks in the industry, like thought leaders like Dr. Rednum, ask their opinion on what do you like about our products? What do you not like? So we're very proactive in thinking, we can always do better. And so why not give it a shot?
And, I've been on the patient side as well as the surgeon side. And for me, I like that the companies that I work with, because there are lots of devices and different uses. And it doesn't mean that one is like, there are multiple good products out there. But I also like to work with companies that I believe are ethical companies and that I believe are forward thinking, because to me, it's a bigger picture. Right. And so that's something that patients, again, they probably don't think all that goes into the thought process, but a lot of us are thinking about those bigger things, because that's important to me as a surgeon. And so it's every detail of your surgery and why we pick things comes down to a lot more factors than you think about.
Sure.
So Shibu, I kind of curious, like, let's say somebody's listening and they're like, hey, I think I want to be a rep. What advice would you give to someone who is starting out new?
Sure. So I don't think I have the typical career of coming into device sales or medical sales, but it's very straightforward. There's some great companies out there, new products are launching from every background. Typically what they'll look for is a 4-year degree and sales experience. You start off with that. But even if you don't have that, because I didn't have sales experience, and I literally used this in the first interview I had at Merck. If you're asking for how many copiers I sold or how many Cadillacs I sold, it's not on my resume. But what I do have is this ability to connect with people. And although I've was in administration, I'm constantly selling my ideas. And then you have to convey that in the interview, because when you get into the interview process, you're selling yourself. Mm-hmm. And sales is very different than anything else. I mean, I think I shared with you, I was an underwriter, I was in financial analyses, a financial analyst for an insurance company. All these different things kind of helps, give me an extra quiver in my little bag. But the reality is I didn't know how to interview with sales. So I actually took on a prep course. Locally, they might have a prep course. I started introducing myself to other sales reps, their managers. Ask as many questions as you can. Talk to your physicians. Do you have a sales rep I can talk to that and tell me about their company and how they got into it? Because everyone's got a different story. Funny thing is, we talk about the fact that most people don't think about going into sales and they kind of find themselves into medical devices. I bumped into a rep just the other day. He's got a degree, I believe, from Arkansas in medical device sales.
There's a degree for this?
There's a degree for this. Yeah, so I guess, the academia heard. There is a need for folks to try and go. I blew my mind. I was like, wow, you actually have a degree in this. So I'm like, I'm just curious.
Cool. I didn't know that you could get a degree.
Right. So there's an actual degree. But if you don't, like I said, you want to try, if you have, just like my buddy Max, who got on board with that trauma company, he's ex-military. If you're an athlete and you're able to go ahead and use that in the interview process, great. Check in with the reps, check in with managers, anybody, physicians that you might know that could share some information and connect you with people locally. That's a big deal. But then the next step is, when you're getting ready for the interview process, you want to not only just have your resume, you want to have what's called a brag book. Mm-hmm. And a lot of people may or may not know about this, but you literally come up with a brag book, because these managers, and here's the thing, I used to be a manager at a previous company. And so, we get inundated by all these like headhunters and what have you. And then I check in with my local reps. Like, hey, bud, a good talent, a good fit for our team. And they give me names of folks, and then these resumes, but not just a resume, but I want to see a resume. I want letters of recommendation, pictures of your awards. I mean, I don't want you to come over here with your plaques in your bag and show this. Take a picture of it, put it in there, go ahead and show me and give me as much ammo to say, hey, if I pull the trigger with this rep, I feel very comfortable with it. They've got the relationships with the physicians that we're calling on. They know the product, and do your homework. Nothing blows me away more than somebody already selling the products that I have without us even training this person. That's wild. Like, how did you do that? I have a buddy of mine named Richard just got on board with a company recently. He put a PowerPoint presentation together of everything he's done. He's been in the industry as long as I have, but he just blew them away to the point where they were going with an internal candidate. They said, no, we got to go with this guy because he can hit the ground running fast. Of course, you have to be coachable, and a team player, and be flexible, right? So all these components come up to, will this person be a good fit for our team? Now, some teams are a lot more aggressive than others. Some are it just depends on the mix of the team, right? So that's what I would say to folks who are interested. And it's wild, there's a lot of people out there that just don't even know how to interview. I actually had a dinner with one of my nephews who's a little bit of a free spirit and smart kid, but he's been super involved with his church, which is great. But now he's thinking of getting married and he's trying to get a job. And he showed me his resume, and he did the Chat GPT version of this, right?
Yeah.
So I was like, I know his writing skills, and this wasn't him. Which he's a smart guy, but then he had a picture of himself on the resume. Now, I love my nephew. He's got long hair. He's got earrings. Kind of looked like me when I was younger. But I was like, you got to clean this up. It's obvious he hasn't had a corporate job before. So I was like, let's get rid of the picture. Let's go ahead and let your work experience speak for itself. And condense it. People don't want 3-4 pages of an interview of fluff. Condense it, 1 page, 2 pages max. Put together that brag book. Have somebody look over it. I'm a big fan of proofreading. If you trust somebody's experience or their background, let them look over it. Check in with the rep that's helping you look for a job. He knows what his company wants. He knows what his manager likes. So it's all about setting yourself up for success. And the more work you do before the actual interview, the easier it is, right? Yeah. And then you can just really knock it out of the park.
That's awesome. Thank you. That's really good advice. Like I said, this is just an area a lot of people don't know about, and hopefully now you guys know a little bit more about it. I think it is a really neat job opportunity for somebody who wants to be involved in medical, but maybe like my side of medical isn't what they're looking for. This is actually, you get to be part of a medical team in a totally different way.
Yep.
And if we didn't have our medical device reps, if we didn't have our reps, there would be a hole kind of there because they do serve, you guys do serve an important part of our team.
Yeah.
So thank you so much for being a part of this podcast today, Shibu. And thank you all so much for listening to the Confidence Doc podcast. And wait till next week. You're going to love what you hear.
As we wrap up another episode of the Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.